Hi, I'm Dr. Mullen with the Medical Marijuana Clinic, and we have several locations throughout Michigan, which we service patients that are seeking medical marijuana cards. A lot of people ask me, why should I come to the Medical Marijuana Clinic? And that's a very good question. We feel that we separate ourselves from other clinics because we practice very ethically. We are totally aware of what's going on in medical marijuana in the state of Michigan. We also read a lot of legal literature, and we know exactly what needs to be done so that when you come here, you get a card that is above any other card as far as meeting all the requirements that are set forth. A lot of people don't know, but there is a ruling by the Court of Appeals as to what is a good medical marijuana recommendation. And here at the Medical Marijuana Clinics, we follow that recommendation to the T. Mostly, we treat our patients as well, which is required, and we offer follow-up visits, and we make ourselves available to patients as any other clinic would that is normally treating patients. There are a lot of clinics that will see you at a hydro shop or at a hotel or a place like that, and possibly even on the internet. But if you ever need to have those people with you in a court of law, if you're ever challenged or have a problem with your card, those people are very difficult to get a hold of. At the Medical Marijuana Clinics, we actually practice medicine in our clinics. We treat our patients for other illnesses, including hypertension, diabetes, and chronic pain. The patients are able to develop a record here as well. For patients that don't have medical records at all, we treat them here and develop a record. If they have been self-medicating and unable to have a recent record, we offer that service as well. At the Medical Marijuana Clinic, our staff are very professional. They're very familiar with filling out the forms and the recommendations so that you have no problems with rejections and things of that nature. In addition to being aware of how to perform a proper exam, and let me take a moment to tell you what that process is. You know, a thorough history is taken. After the history is taken, we review all your medications. Our visits last at least, with the doctor, 15 to 20 minutes and even longer sometimes if they're complicated. And that's regardless if it's a cancer patient who would seem to be a slam dunk patient while they undergo chemo needing medical marijuana to prevent vomiting, or if it's someone with just a minor back problem. We feel that this is a potential legal document, and we want to make sure that we address all the legal issues in every recommendation, as well as spending time with the patient to document all the necessary items that are required. As I said, our staff is very professional. In addition, our doctors, especially myself, has written many articles in Medical Marijuana magazine regarding medical marijuana. So I'm not just signing a recommendation. I can also provide advice regarding what strains are better for you with your condition. And we have a lot of literature that reflects some of the articles that I've written that we make available to our patients upon request. We make sure everyone has a follow-up visit, which is required. If you read the bottom of the recommendation now that the doctor signs, there's an area there that says that he will revoke a card if the patient is not qualified. So we offer the patients methods to meet those criteria so that there's no issues with their cards at all. At the Medical Marijuana Clinic, we're ready to serve you at 3 locations in Detroit, Plymouth, and Jackson. And you're welcome to make an appointment. We have appointments on Saturdays and throughout the week at our locations. I had a question from a patient that was a diabetic, and they had asked me if they're a diabetic, how can they obtain their medical marijuana card? Well, certainly if you're a healthy diabetic, we're unable to provide a medical marijuana card for you, but for the patients with diabetes that are suffering from diabetic neuropathy, providing a medical marijuana card to treat that neuropathy is not a problem. Diabetic neuropathy is very severe and painful. Usually starts in the lower extremities because it's farthest from the heart, and the sugar tends to loiter in that area, causing nerve irritation. This nerve irritation will lead to what we call aggravating numbness and pain, especially at night, and patients with these symptoms can easily qualify for a medical marijuana card. How do you know if you're a patient of that nature? You've probably talked to your doctor and they've tried Neurontin, pain pills, or Lyrica, or drugs such like that, and you were unhappy with the outcome of using those medications. Some people have tried marijuana and it's helped their symptoms. That's because of marijuana's exceptional ability to provide neuropathic pain relief. Marijuana is well known as a seizure medication, and diabetic neuropathy, if you look at Neurontin and Lyrica, these are also seizure medications that have been used to treat patients with diabetic neuropathy. So if you're having diabetic neuropathy and a lot of pain in your lower extremities or your hands or anywhere of that nature, feel free to call and make an appointment at the Medical Marijuana Clinic of Jackson. A lot of patients come to the medical marijuana for pain. You don't have to be a patient that's had back surgery or a patient that's been given morphine to qualify for pain management with medical marijuana. Medical marijuana, it does a good job at treating pain. Patients have all kinds of pain. Let's look at the criteria of what is chronic. Chronic is a condition that should have resolved but has lasted 3 months over the typical length of stay that the condition would normally last, therefore meeting the diagnosis for chronic. Now, severe pain is a pain condition that requires medication that is used to treat severe pain. Usually that's a narcotic. So if you've been given Vicodin for your pain, Tylenol 3, Tramadol, or chronic Motrin, which can cause stomach ulcers, then medical marijuana may be the choice for you. That could include patients with anything from simple as a bunion to brain surgery. So even though a bunion may not seem like a terrible condition, for those that have it, you have your entire weight during your whole waking time of the day on that area, and that creates pain, and it's often chronic. It can be fasciitis of the feet, it could be cramps in the legs. A lot of smokers get what's called claudication at night. Those are those leg cramps, and that would fall under the category of spasms. Certainly it's good to mention it to your doctor, because when that doctor says you have it and you come to the clinic and one of our doctors agrees that you have it, that's 2 doctors that are aware of this condition and the elements and the pain that it's causing you. Other pain can be anything from shingles. I've seen patients on Oxycontin for shingles. I've seen patients with morphine pumps in their back for pain, or on Motrin for pain, but it's still chronic pain that could benefit from marijuana. Headaches is a big one as well. Long as we can do a diary of your headache and document your pain, that would certainly help make the medical history more clear, and then you want to connect it to benefit from using the marijuana and why it had worked better than other medications. And that's really all you have to do. Also, I see a lot of veterans that are suffering with pain. They have come back from Iraq. I can't tell you how many young soldiers I've seen, and it's my pleasure and honor to treat those patients. And we hope that the veterans that are suffering would, and who have clandestinely used medical marijuana would consider coming to the medical marijuana clinic and getting certified. We get a lot of referrals from the Veterans Hospital for our patients, and certainly any veteran that is suffering from anything from major surgery to just being physically shook up in an IED or driving through the city of Iraq and through the mountains of Afghanistan. I've seen them with major disabilities from those activities. We see a lot of patients with various kinds of cancer. Even though your cancer may be in remission, a lot of patients that have had chemo or radiation suffer chronic neuropathic pain. You heard me talk about neuropathic pain from diabetes. You can also get neuropathic pain from either chemo or radiation. A lot of patients will have residual effects, and the pain will be similar to what I talked about with shingles. Certain nerve groups that were affected by radiation will cause chronic pain long after the cancer is gone. So even though your condition was treated years ago, if you're getting symptoms, a lot of patients benefit from medical marijuana when treated who had these problems.